Okay, another week, another day, and welcome to today's Health Literacy and Psychosocial virtual session organized by SAOPA, a nonprofit making organization for the prevention of transmission of HIV and AIDS. SAOPA delivers the following programs: one on healthy youth development, one on health literacy and psychosocial support, and lastly, on empowerment, skills development, and training. The objectives of the health literacy and psychosocial support program are to improve the general knowledge and understanding of chronic diseases, to promote adherence and healthy lifestyles, to enhance the coping mechanisms and mental health of all people, including our youth who are on chronic medication, family caregivers, as well as our community health workers. Ladies and gentlemen, we may all agree with me when I say that adherence to our treatment, especially medical treatment, is very key to healthy living. Well, I'm not an expert, but today in our midst, we do have an expert, a very keen and dedicated health professional with interest in holistic wellness. She has a wealth of experience both in the public as well as the private sector. She's currently responsible for HIV and AIDS management and wellness programs, including management of modern ailments such as tuberculosis, sugar diabetes, high blood pressure, as well as cholesterol. She's a panelist of the Independent Tribunal for Social Assistance Appeals. She's a member of the HPCSA, a professional committee, as well as the Assistant Professional Association. Ladies and gentlemen, I've indicated that I'm not an expert, but today we are really honored to have in our midst Dr. Putuka, who's going to take us through issues relating to adherence. A round of applause to our medical doctor, Dr. Putuka. Over to you, ma'am.
Thank you so much, Cynthia, for that wonderful introduction. Now, without wasting any further time, let's get to our reason for today's meeting. I'll start sharing the slides. Okay, today it's going to be more of an interactive session. And I can see it's only the four of us now. However, we will still do it as I have planned to do it, because we are hoping that whenever someone listens to the recording, they can actually put themselves in our shoes. Okay, today we are continuing talking about cardiovascular disease. Okay, I have a case that I would like us to go through. Okay. This is a made-up case. It's not an actual patient. This is just for the sake of learning. I have Mr. Nkosi, who is a 66-year-old male widower. Mr. Nkosi holds an executive position at work, so he has to deal with quite a lot. He is currently working from home because of the lockdown restrictions, and he has not been exercising for the past 6 months and has gained a lot of weight. And I'm sure most people can relate to this. He has to submit a report and is stressed because he couldn't finish on time. Well, Mr. Nkosi has 4 children, And he always takes out because he just feels that at times there isn't enough time for people to cook. He has a nanny who does not live there, who comes and goes. That's why at times they have to buy takeouts. Mr. Ngosi smokes plus minus 10 cigarettes per day and drinks almost every day to try to deal with the stress. He presented with headaches for more than 2 weeks and decided to consult. At the consultation, his blood pressure reading is 160 over 110. He was allowed to rest for about 5 to 10 minutes, and a repeat blood pressure reading was 150 over 100. And Mr. Ngosi's mother has high blood pressure and diabetes mellitus. Okay, what's going on through your head now? Okay. Let's see, what risk factors does Mr. Ngosi have for high blood pressure? I'll just refresh our memories with this part of the question, and the next part will be more interactive. Okay, we can see that Mr. Ngosi has a family history of hypertension. His mom has hypertension, and he also has a family history of diabetes mellitus. Well, Mr. Ngosi is a smoker. Mr. Ngosi drinks alcohol, and Mr. Ngosi is physically inactive. So what is the rationale? We know from the previous presentations that smoking, excessive alcohol intake, and physical inactivity are strongly associated with hypertension. So, okay, before I go back to this section, let's just have an interactive session. Okay, having listened to that, do you agree with me with regards to the risk factors for hypertension?
Absolutely, yes. Oh, for sure.
Awesome, awesome. Cynthia, would you like to say something? Okay.
Okay. Maybe Cynthia's going to get herself a cup of coffee.
Okay. All right, then. Wonderful. We'll continue then. We'll go on to the next session, the next part of the question.
Yes.
Okay. Okay, then. At his first visit, the healthcare professional that was helping Mr. Ngosi decided to also do these tests. He did his random blood glucose, which was found to be elevated. He also did an HbA1c test, which is a test that checks for blood glucose in the past few months, not only for that period of time, but it's over a few months, and it was found to be elevated. Mr. Ngosi also had raised cholesterol, raised triglycerides, and his repeat blood pressure was 150 over 90. So,
Okay.
what risk factors for cardiovascular disease does Mr. Ngosi have now? We spoke about the risk factors last week about cardiovascular disease. So from the readings that I've just shared, what do you think are the major risk factors? What do you think are the contributing factors for cardiovascular disease?
Could I ask you maybe just what is his random BG11? What does that stand for again? Sorry, dear.
Sorry, it's blood glucose, random blood glucose. When we test blood glucose, yeah, if you have not fasted, we say it's a random blood glucose, and it has to be between 7 and 10 years. So a fasting glucose would definitely be less, but now this is just a random blood glucose.
And the HbA1c8?
This is a test that I said it checks the blood glucose in the blood for the past few months. Not only, the random is just a stat, like a now blood glucose, but the HbA1c, yes.
So these first two are actually related to blood sugar levels.
Yes, they are related to blood sugar level.
Okay.
They both confirm that his blood glucose is raised.
Okay, and then the cholesterol and the triglycerides, that is basically like a cholesterol reading, right?
Yes, the lipids in the blood, yes.
Yes, okay, and then the BP, that's blood pressure. Okay.
That's blood pressure, yes.
Okay, sorry, could you repeat the question again?
Okay, now I'm saying, what risk factors for cardiovascular disease does Mr. Ngosi have?
Oh, okay, the bottom three: raised cholesterol, raised triglycerides, and repeat blood pressure.
Awesome,
Yes,
awesome.
I feel agree with Patrick. I think with the high cholesterol level, with hypertension, you know, and he's more likely, you know, to can have a heart condition.
Yes.
Awesome, awesome. Thank you guys for contributing.
Pleasure.
Okay. All right. Now, yes, I agree with both of you. We have major risk factors and we also have contributing factors. Now, what are our major risk factors? The high blood pressure. High blood pressure, remember, it increases your risk for heart disease. It increases your risk for heart attack and stroke. And of course, if you are obese and you smoke and you have high cholesterol levels as well, and along with the high blood pressure, your risk of heart disease or stroke greatly increases.
Yeah,
Blood pressure can...
well. Okay.
The...
Sorry, I just never realized that the stroke was included there as well. Wow.
Oh, okay. No, I didn't mention the stroke. I just mentioned the cardiovascular disease, but I'm just, when, you know, I just felt I needed to emphasize that it not only contributes to cardiovascular disease, but it also raises your chances for stroke.
Okay. Okay. Thanks for that. Thank you for that.
Awesome. Awesome.
Yes.
And then what I can also say is blood pressure can vary with activity and it can vary with age, but a normal reading for a healthy adult who is resting should actually be 120/80. But remember last week I said anything below 130/80 is acceptable. So in this case, our patient has a repeat BP of 150/90. So this is raised. It confirms high blood pressure.
Yes.
Are we still all on the same page?
Yes, I'm a 130/80. Just
awesome, awesome. For your age, awesome, awesome.
Yes.
We must just maintain it at that level. Cynthia, do you perhaps, what is your blood pressure?
For now, I'm not good with numbers, so I can't remember. But typically, I used to have a sort of low blood, but I think with my health condition, sometime last year or even this year, it went a bit high, but not that much high. So I was just put on observation. Then it suddenly went down. So far, I've never had any issues, and I hope, you know, it stays that way.
Okay, awesome. I also have low blood pressure, so mine is always around 110 over 70, or it can even go up to 100 over 60. But that is the topic for another day.
Okay.
And then the other major risk factor is cigarette smoking. I think we mentioned this the past few sessions. We mentioned how tobacco smoking can increase your chances of other diseases on top of cardiac disease. It can increase your chances of lung cancer. And remember, I even said most people tend to think smoking is only associated with lung damage, but smoking actually affects almost every organ in the system. It
Yes.
can, yes, it greatly increases your chances of heart disease as well, and peripheral vascular disease, which we mentioned last week and said it's the disease in the vessels that supply blood to the arms and the legs.
Uh-huh.
And yeah, actually, how does smoking work? Smoking actually increases your heart rate, it tightens the major arteries, and it can create irregularities in the timing of the heartbeat, all of which makes your heart work harder. Smoking raises your blood pressure, and remember, raised blood pressure is a factor for cardiovascular disease. And although nicotine is the main active agent in cigarette smoke, other chemicals and compounds like tar and carbon monoxide are also harmful to your heart in many ways.
Yes.
Okay. All right, now let's move on to diabetes mellitus. We
Yeah.
confirmed that our patient has high blood glucose. We said a random blood glucose of 11 and a raised HbA1c of 8. And
Wow.
heart problems. Heart problems are actually the leading cause of death among people with diabetes, especially in the case of type 2 diabetes, which is also known as non-insulin dependent diabetes.
Yes.
Yeah, and so if you have diabetes, you have to be under a doctor's care because we need to control your sugar levels so that they may be within the normal range below 7. If we take a random blood glucose of, if it's less than 7, it is acceptable. However, if you are diabetic, anything less than 10 is still acceptable.
Yes.
Okay, and then we now move on to lipid abnormalities. We mentioned that our patient has raised cholesterol and raised triglycerides that also contribute towards the towards your cardiovascular disease risk.
Okay.
And gender is also associated with cardiovascular disease risk. Can you believe it?
Yes. Wow.
Yes.
Is that
So
why the males are more stressed because they have to bring in the money?
maybe, I think so, because they are the providers. Yeah. So I think
Yes.
mainly they are more stressed.
And physical activity, I think you forgot as well. Inactivity, sorry.
Oh, yes. Oh, sorry. I forgot to mention physical inactivity, which is very important.
Yes.
Which we know that we cannot emphasize this more than what we have done. People who are not active have a greater risk of heart attack than people who do exercise regularly.
Yes.
Exercise burns calories and it helps maintain a healthy weight. And it also helps to control cholesterol levels and diabetes. And it may also lower the blood pressure. So that's how important exercise is. And exercise, on top of that, it also strengthens the heart muscles and make the arteries more flexible.
Uh-huh.
So I believe each and every one of us should be exercising every day If not, at least 3 to 5 times per week.
Wonderful. Wonderful.
Yeah. Okay, and then we said the male gender have a higher risk.
Yeah.
And then, but then there comes a change. The difference narrows after women reach menopause. After the age of 65, the risk of heart disease is about the same between males and females.
Why is that?
Because I think studies have just shown that once you've reached menopause, your chances of heart disease is the same. I will have to do, I don't have actual statistics and the reason for that, but I think studies have shown that men and women who are more or less over 65, they have the same risk of cardiovascular disease as opposed to a young female who's 40. Her chances of cardiovascular disease are decreased as compared to a male who is the same age, 40.
Maybe it's because she's worried about her children.
Yeah.
But is it not the hormones? Don't they have an impact? You know, don't they play a role? You know, in women's susceptibility, you know, to heart diseases.
I think they most probably do. I will have to check that and you know, just give you a definite answer at our next session.
Wow, that'll be wonderful. That'll be wonderful. Thank you, Nolwazi.
I will most certainly research that.
Okay.
All right. And then another risk factor, which I did not write here, is definitely age. Older age is a risk factor for heart disease. So our patient, we said he's 66. So age also contributes to his risk for cardiovascular disease.
Even if he doesn't have high blood pressure?
Even if he doesn't have high blood pressure, even if he doesn't have diabetes, even if he's, you know, he's not obese, the fact that he is older, his chances of heart disease are increased.
I see.
Remember, as we age, our hearts tend to not work as well as when we are young. The heart walls may actually thicken and the arteries may stiffen and harden, making the heart less able to pump blood to the muscles of the body. So because of these changes, the risk for developing heart disease will increase with age.
Can I make just ask a question?
Yes.
If you were, like, say, a young man and you were very conscious of your health and you watched what you ate and you didn't smoke and you maintained your blood pressures and you did physical activity and you kept your body basically going in terms of, would that make a difference with age?
Remember, I've just said as you age, your walls thicken, but most probably because you were taking care of yourself, even though your heart walls are thickening and the arteries are stiffening as a result of age, your chances of heart disease are not as high as for someone who was irresponsible.
Okay.
But because of your age, it's still a risk factor.
Okay. Yes, I was just making sure that it's not age only, because everybody doesn't die at the same age. So
absolutely. So definitely, if you look very well after yourself, even though you are aged, your chances of cardiovascular disease are not as high as for someone who was irresponsible, someone who was not exercising, someone who was smoking, someone who had high blood pressure, because even high blood pressure has an effect on the walls of the heart muscle.
Yes. Okay.
Yeah, so I think, Cynthia, you're probably right when you say hormones, you know, they usually protect women from heart disease until, of course, menopause. But I will confirm that in our next session.
Mm.
Yeah, and then the other contributing risk factors, remember I mentioned that our patient drinks almost every day. So alcohol consumption is also a risk factor for cardiovascular disease. And yes, yes. And also we said he's also stressed. I mentioned, I just created these scenarios just to make sure that we emphasize the risk factors. I mentioned that he has stress at work. So stress is also a contributing factor for heart disease. In fact, they say science has shown that the effects of emotional stress, behavior habits, socioeconomic status on the risk of the heart disease is actually still being studied. But however, stressful situations are associated with raising your heart rate and blood pressure. I think we can both agree that when you're stressing, you can actually hear or feel your heart pumping.
Exactly.
Yes, and increasing your heart's need for oxygen. This increased demand for oxygen can lead to insufficient oxygen-rich blood getting to the tissues, or it can even bring on chest pain.
Yes.
That's how it affects the cardiovascular system.
But I think that's why physical activity it really plays a strong role, because if your heart is used to being raised in pressure and circulation is being forced through the veins and arteries, and they are continuously expanding and contracting, and they're used to that kind of stress of maybe physical inactivity, that when a stressful situation comes about and the blood pressure rises up and that sort of stuff, then it won't be as bad. Yeah.
It won't be as bad if you are actually someone who exercises, yes.
Exactly.
And remember, exercise actually helps you cope with stress as well.
Yes. Oh, absolutely. I agree with that.
Yes, yes.
Yes, yes. Wow.
And,
Awesome.
And stress also increases the amount of blood clotting factors that circulate in your blood, making it more likely that a clot will form.
Wow.
And clots, yeah, and we don't want clots because they may block an artery, and an artery that is probably narrowed by a plug and even cause a heart attack. So
yes, exactly. Oh my goodness, yes. So this model that you gave us, this man and this lifestyle that you opened up to us, this guy's he's ready to at the slightest provocation just to fall down on his back and say goodbye.
Absolutely. Yeah. If he doesn't make changes, then chances are he will not live to walk, to see the great grandkids.
Yes. Wow.
Yeah, and stress may also contribute to other risk factors. For example, people who are stressed may overeat for comfort. They start smoking or smoke more than they normally would. So that's how stress can contribute towards the cardiovascular disease.
Yes, I would personally like to see the diet issues also on this list as being quite important. Exercise is very important for longevity, but I think diet is also as important.
Thank you for bringing that up. Yes, I can see that we are really, because I did mention that he actually, that part I mentioned that he buys takeouts most of the time.
Takeaways, yes.
Takeaways. So we can see that he's not eating healthy, hey? Even though, and I actually think I even mentioned that he gained weight. You see, I even mentioned there that he gained weight in the past. Yes. So thank you for bringing that up, Patrick. Thank you so much, guys. So definitely, diet is also a contributing factor for cardiovascular disease.
Amen.
Awesome.
Dr.
That was our
Dr.
case.
Lazi, I
Yes,
wanted to
my
say
dear.
that last week we spoke about the lifestyle modification. So there's actually plenty here that needs to be, undertaken by our by our friend here in terms of, the diet, for example,
Yes,
the exercise,
yes,
watching,
yes.
himself,
Mm.
and so forth. So I think it's sort of a continuation. I agree with Patrick that, the lifestyle modification is very, very, very key. Looking at all the aspects, of
There is
wellness.
absolutely. Absolutely. So it goes back to saying, what now should we say to our patient? We should encourage him to eat healthy, a balanced diet. We should encourage him to quit smoking. We know it's not easy, but we'll work with him and refer him, if necessary, to people who can assist him with quitting. And we are also saying, we are encouraging him to be physically active, regular physical activity. We can ask him to just start by walking 20 to 30 minutes a day and see if that won't work for the blood pressure as well. And because already he has lipid abnormalities, already he has diabetes, this is someone who should, take his medication. Remember, we said another control measure is making sure that chronic conditions are controlled. Blood pressure should be controlled with medication. That blood glucose should be controlled with medication. This patient should also be taking lipid medication, your statins, lipid lowering medication as well, because a patient who has high blood pressure and blood glucose, their chances of stroke are high. So this is someone that we really need to control and to probably review monthly to make sure that everything is within the normal range.
Yes, that's why diet is also so important for diabetes.
Absolutely.
Mellitus. Yeah, no, that's
Absolutely.
so, what a wonderful lesson. Beautiful. Thank you so much so far.
Thank you guys for making it interactive and very nice. Okay, so now I just wanted to go back to the heart. I think the heart is such a fascinating organ. And just to share, to share the, the functions, the main functions of the heart. And it will help us understand why we really need to take care of it. Remember, the heart is useful for pumping oxygenated blood to the other body parts, which is necessary. The heart is necessary for pumping hormones and other vital substances to different parts of the body. And it's also responsible for receiving deoxygenated blood and carrying metabolic waste products from the body and pumping it to the lungs for oxygenation. And finally, the other function of the heart is to maintain blood pressure. I think we all know that the heart is actually a muscular organ that is about the size of your fist. And just to, emphasize, it actually lies in the front and middle of your chest, behind and slightly to the left of your breastbone. So now let's move on to, why is my slide not moving? Okay, now let's get back to this fascinating organ. We said the heart has 4 chambers. The right atrium receives blood from the veins and pumps it to the right to the right ventricle, sorry. The right ventricle receives blood from the right atrium and pumps it to the lungs, where it is, remember we said it is oxygenated, and let me just go back, and the waste products are removed.
Mm.
The left atrium receives oxygenated blood from the lungs and pumps it to the left ventricle. The left ventricle, this is the strongest chamber of the heart. This one pumps oxygen-rich blood to the rest of the body. That's why it has to, it really does the most work. The left ventricle's vigorous contractions create our blood pressure.
Yes.
Okay, these are some of the conditions that we discussed last week. We discussed coronary artery disease, and I stressed the fact that cholesterol plaques can narrow the arteries supplying blood to the heart, and the narrowed arteries are at higher risk for complete blockage from a sudden blood clot, and this blockage is actually the result of a heart attack. And when you have a heart attack, your heart muscles are starved of oxygen and they end up dying. And we also mentioned cardiomyopathy, which we said it's a disease of the heart muscle in which the heart is abnormally enlarged, it is thickened, or it can be stiffened as well. As a result, the heart's ability to pump blood is weakened. And cardiac arrest, this is the most dangerous condition of the heart, whereby you get sudden loss of heart function, and patients do not come back from this unless if they get urgent assistance. And this is the one that we mentioned, that most males are actually dying from cardiac arrest because of your lifestyle, be it smoking, be it not eating a healthy diet, physical inactivity. So this is just to re-emphasize some of the conditions that we discussed last week. And then the tests, some of the tests that can be performed for heart conditions are an electrocardiogram, which is known very well as an ECG or EKG. This is a tracing of the heart's electrical activity. Electrocardiograms can help diagnose many heart conditions. Another important test is your echocardiogram. An echocardiogram is actually an ultrasound of the heart. It provides, it actually provides direct viewing of any problems with the heart muscles pumping ability and the heart valves.
Can you look right into, does it dissect the heart like the drawing that you gave us?
Yes, and it sees everything that's happening inside the heart.
Wow.
Awesome.
I'd love to see a video of that.
Of that, hey? Yeah, we'll probably
be unreal.
We'll make a plan for that. We'll definitely make a plan in one of our sessions.
And an electrocardiogram.
An electrocardiogram.
Yeah, that would be so cool.
Awesome. We'll definitely do that.
Okay. Wow.
Yeah. And then we also have cardiac stress test. I think, I'm not sure if any of you guys have done this, but I've had a cardiac stress test done. It's where a treadmill is
not
used.
yet. Yeah.
Not yet. Okay, I've had one. When you think your heart could be giving you problems, so you just go for a consult, and just for screening purposes, they use a treadmill, or they give you medicine to stimulate the heart so that it can pump to near maximum capacity.
Wow.
And this will definitely identify, yes, people with coronary artery disease. Awesome, hey? Yes.
Wow. So what does it
Yeah.
do then? Okay, they put your body under stress, and then they take an electrocardiogram and an echocardiogram
Yes.
at the same time, and they just look
Yes.
at everything. Okay, wow, nice.
Awesome.
Nice.
And then we also have cardiac catheterization. This is now an investigation where a catheter is inserted into the femoral artery in the groin region and threaded into the coronary arteries. Yes.
Oof.
And with this, yeah, a doctor can view X-ray images of the coronary arteries or any blockages and perform a stenting or any other procedure.
Is there a camera at the end of this?
Yes, yes.
Yes. Okay. Okay. With some light as well, I imagine.
With some light as well, absolutely.
Wow.
Awesome. And
Awesome. What happens,
yeah,
but they don't let it get into the heart? I mean, can you imagine if it starts getting stuck on the valve or something like that?
yeah, no, that's why they only do it in the, in the, just to see, to look at your arteries.
Yes. Wow. Okay.
And then we have a Holter monitor. This is if a doctor suspects arrhythmia, a portable heart monitor can be worn. Remember, we said arrhythmia is when the heart does not beat the way it should.
Yes, it goes all erratic.
Absolutely, yes. So the Holter monitor can record the heart's rhythm continuously for 24 hours, just to make sure that it's to confirm if a patient has arrhythmia.
Yes. So, but now,
And
what exactly does the Holter monitor? Sorry.
you see, sometimes you may say my heart beats funny, and then when you go and consult, when the doctor checks you up, the heart rate is normal. So this is it checks the heart rhythm for 24 hours in a row.
Oh,
Because
I see.
sometimes the heart, you see, sometimes it can beat, and so it's just for making sure that within the 24 hours, are there any abnormal heartbeats?
Okay.
Over a period. Yes.
Okay.
And then we also have.
But what can they determine from that, other than there's things are going wrong? Because apparently, I mean, when you get all stressed up, your heart goes faster, and apparently, I was reading somewhere that your variable heartbeat, your heartbeat never stays exactly at the same beat all the time.
Absolutely.
Continuously speeding up and slowing down and speeding, depending on the energy requirements of the body and stress levels and all that kind of stuff. So so that's why it's probably a good thing to take it over 24 hours. They'll probably be able to see whether you got a lot of stress or not, eh?
Absolutely. Absolutely.
Yes, wow, that's cool.
And then the other interesting one is an event monitor. If a doctor suspects an infrequent arrhythmia, they also put a portable heart monitor, which is now referred to as an event monitor. And when you develop, when you feel funny, because you can tell if your heartbeat is abnormal, then you can push a button to record the heart's electrical rhythm.
Okay.
Yes.
Is that something like, I mean, these new iPhone watches can read your heartbeat as well?
Yes.
Okay, so wow, technology is.
Yeah, I think it is.
Technology.
Indeed. I think we are being. I wanted to say that we are being empowered also, Patrick. We are really being empowered. Thanks, Dr. Lwazi.
You're welcome. Okay, now before I'm gonna play a short video after this slide. I just want to go back to talking about treatment, because this is chronic illnesses and adherence. We need to adhere to treatment. So what are some of the treatments for heart conditions? Exercise, we spoke about exercise. Regular exercise is important for heart health and for most heart conditions. But remember, as a patient needs to first talk to their doctors before they start any heart program, because not everyone can do certain forms of exercises. So before you do, those intense activities, you need to talk to your doctor. But a walk, a simple, normal paced walk is still fine.
Good.
And then we have angioplasty, which is, during catheterization. Remember, we spoke about catheterization in my previous slide. A doctor will inflate a balloon inside a narrowed or blocked coronary artery to widen the artery, and a stent is often placed to keep the artery open. This is now for those who have a lot of buildup of plaque.
So they probably have to do that quite fast, because can you imagine he puts a balloon in, and then if it takes too long, your blood flow can stop, and that could cause you to die.
Yes, absolutely, absolutely.
Wow.
And then sometimes an angioplasty is called a percutaneous coronary intervention, or also these are just other names of angioplasty that can be performed. Percutaneous transluminal coronary angioplasty. And then we also have coronary artery stenting. During cardiac catheterization, a doctor expands a wire metal stent inside a narrowed or blocked coronary artery to open up the area.
Yes.
This lets blood flow better and can prevent a heart attack or relieve chest pains.
Wow.
Yeah.
Okay.
And then we also have, thrombolysis, which is, clot busting drugs that can be injected into the vein to dissolve a blood clot, causing a heart attack. So this procedure, but this is only done if stenting is not possible.
Okay.
Yes, and remember we said the buildup is usually due to fatty deposits.
Yes.
So another way of treating cardiac disease is using statins or any other cholesterol lowering drugs to decrease your risk of heart attack in high risk people. Okay. And then of course, controlling your blood pressure, be it with your diuretics, your beta blockers, and aspirin. Now we have, patients who are high risk, people with hypertension, people with diabetes and cholesterol are put on aspirin daily to prevent blood clots.
Okay.
And people who have had a heart attack should also take aspirin.
So this is like an advanced form of cholesterol then?
Yes.
Okay.
Yes. So these are your diuretics. Your diuretics are mainly for your blood pressure patient. Beta blockers are also for your blood pressure patient. Beta blockers also lower your heart rate. So before you are put on a beta blocker, the healthcare professional needs to make sure that your heart rate is nothing below 50, because if it's below 50, the beta blocker will drop it even more.
What is a beta blocker?
Atenolol, an example is atenolol.
Oh, sorry, say it again.
Atenolol. It's given to patients who have high blood pressure with very high heart rates of 90s, 80s, a resting heart rate that is very high. So it lowers the blood pressure, but at the same time, it lowers your heart rate.
Okay, then what does beta mean?
Beta blocker.
But what does the beta stand for?
It's just called beta blocker.
Oh, okay, okay, okay. My goodness.
Yeah,
Yeah,
it's used to reduce the strain on the heart and lower the heart rate.
yes,
So at the
yes,
same time, working on the blood pressure.
yes.
And then we have, your angiotensin converting enzyme inhibitors. This is the very commonly known as Covasil Pharmapres. This is blood pressure medication. It helps the heart after heart attacks especially, and it also prevents congestive heart failure.
Okay, okay.
Yes. Then we mentioned that aspirin is given to patients who are at high risk for cardiovascular disease. And yes. And then we also have AED. I just put that there for interest's sake. AED is an automated external defibrillator. If someone has sudden cardiac arrest, remember I said the sooner you get attention, the better. So if someone has had sudden cardiac arrest, an AED is a machine that can be used to assess the heart rhythm and send an electrical shock to the heart if necessary. And then, and we also have your implantable cardioverter defibrillator. If a doctor suspects that you are at a high risk of life-threatening arrhythmias, they may implant a cardioverter defibrillator surgically to monitor your heart rhythm and send an electrical shock to the heart if necessary. And yeah, the commonly known is a pacemaker. We have patients who have a pacemaker inserted to maintain a stable heart rate. And yeah, a pacemaker is actually implanted. It also sends electrical signals to the heart when necessary to help it beat properly. Okay. And then in closure, I just want to play, a nice video that summarizes what I've just said.
Awesome.
Okay, let's play the video. Interesting. The heart is an interesting organ, hey?
Very.
It is very interesting, Dr. Lazi. Very, very interesting.
Yes.
Hi, welcome to the video. In today's revision session, we're going to be focusing on the heart.
Can you all
Let's
see?
first start with some basic anatomy. Here is a...
Can you all see and hear clearly?
Yes, we can. Yes, we can.
Awesome.
We can.
Awesome.
Diagram of the heart. You can see the left and the right atrium and ventricles. Remember, we label this as the anatomical position, so the right ventricle and atrium appear on the left of the diagram. We can look at the anatomical position of the heart within the rib cage. This allows us to determine the four corners of the heart. The upper left corner of the heart is located at the second intercostal space. The lower left corner of the heart, where the apex of the heart is found at the fifth intercostal space. The upper right corner is located at the third costal cartilage, and the lower right corner is at the sixth costal cartilage. Oxygenated blood flows through the left-hand side of the heart, with blood entering the left atrium via the pulmonary veins from the lungs. It then passes down to the left ventricle via the mitral valve. The left ventricle has a thicker muscular wall than the right ventricle, so it can pump blood around the body at a higher pressure. The blood then exits the heart to systemic flow via the aortic valve to the aortic arch. The aortic arch then branches into the brachiocephalic trunk, the left common carotid artery, and the left subclavian artery. Once it has passed through the body, the blood returns to the heart, deoxygenated, via the inferior and superior vena cava into the right atrium. It then passes to the right ventricle. The valve on this side is called the tricuspid valve. The blood then exits the heart to the pulmonary trunk via the pulmonary valve, where it then flows into the left and right pulmonary arteries to take blood to the lungs. These are the only deoxygenated blood-carrying arteries in the body. So what are some of the functions of the heart? The heart helps to control blood pressure, which is important because blood must reach the furthest parts of the body to give an adequate supply of oxygen and nutrients to all tissues. Blood pressure is the force or hydrostatic pressure that blood exerts against a blood vessel wall, and it varies based on A, the system, B, the distance from the left ventricle, and C, whether the heart is in systole or diastole. Have you ever wondered how the heart beats? The key point here is that the pumping action of our heart is regulated by an electrical conduction system that coordinates the contraction of the various chambers of the heart. Firstly, the heart is innervated by both parasympathetic and sympathetic fibres. These fibres pass down the heart from the medulla located in the brainstem by way of the vagus nerve. So, what is the pathway of electrical stimulation? The sinoatrial node, located here, generates an electrical stimulus, hence why it's known as the heart's natural pacemaker. This small mass of specialized tissue produces an impulse that travels to the atrioventricular node, located here, where the impulse is slowed down temporarily, then continues down the conduction pathway via the bundle of His. The bundle of His branches into left and right bundles that run along the interventricular septum. The left bundle branch further divides into the left anterior and the left posterior fascicles. These bundles and fascicles give rise to thin filaments known as Purkinje fibres. These fibres innervate the two ventricles so that they contract in sync, allowing for a coordinated and controlled rhythm of blood circulation. Now, what happens when things go wrong in the heart? There are many possible diseases of the heart, an example being coronary heart disease. This occurs when one of the coronary arteries supplying the heart with oxygenated blood is blocked or interrupted by a buildup of the thromba. Causes include smoking, lack of exercise resulting in obesity, hypertension, high cholesterol, and type 2 diabetes. Chest pain, also known as angina, and heart attacks are the two main symptoms of coronary heart disease. Statins and beta blockers are the two main types of drugs used to treat the symptoms of coronary heart disease. Beta blockers reduce blood pressure, and statins inhibit enzymes that synthesize cholesterol in the liver. An alternative treatment to drugs are stents, which widen blood vessels to reduce blood pressure. So to summarize, we've covered the basic anatomy of the heart, its blood flow, electrical stimulation, and coronary heart disease. We hope you found this video helpful. Thanks for watching.
Awesome.
Awesome. Thank
Very,
you,
very
guys.
helpful.
Wow.
I
Wow.
hope
Wow.
you
I'd like you to take
enjoyed
a
it.
second, really look at yourself. I don't
Yeah.
mean
Oh,
take
no,
stock of your life, which
Sorry.
really isn't any of my business, but I mean, just look at your body.
Oh, wow. Thank you
Yes,
very much, Dr. Lazi. Thank you very much for the wealth of information. I think as we are attending these sessions, Patrick, you would agree with me that we are being educated day by day. I'm really being educated,
absolutely.
knowing about your body, the possible, health risks, the lifestyles modification that one has to, it's quite overwhelming, I must be honest with you. And then thank you very much for the wealth of information that you've just shared with us. I think we've come to the conclusion of today's session, and I would like to extend a word of gratitude to our partners, particularly the Department of Health, who are actually supporting Southwater's interventions, to our consortium members, as well as the community at large. Without the community receiving the services that Saopa is offering, there would be no Saopa. And I think a word of gratitude also goes to our healthcare workers, who those who have attended the previous debriefing program, and those who continue to attend the programs that Saopa is offering. Oh, I forgot to switch on. I forgot to switch on the mic. I was saying that a word of gratitude also goes to our healthcare workers, for having supported SAOPA by sort of attending, the debriefing programs that are sort of being organized, by SAOPA. Without our healthcare workers, obviously, there is no SAOPA. And I also want to share, the fact that SAOPA is actually exploring, other avenues or platforms, for disseminating the information that that is being produced, or the presentations, by the various speakers. So just wash out the space. On that note, ladies and gentlemen, wish you a blessed evening till we meet again. Good night.
Good night.
Thank you so much, and bye.
Good night.
Bye-bye.
Bye-bye, Nightingale.
Bye.
Bye-bye, Cynthia.